Now, some parents of the Accra Girls Senior High School are demanding for the return of their wards following increased cases of COVID-19. Maxwell Agbagba, in a visit to the school, confirms at the last count, the school had recorded 55 positive cases.
We are here right in front of the Accra Girls Senior High School, where we're told that they've recorded 55 cases, confirmed positive cases of coronavirus. That was in a joint statement released by the Ghana Education Service and then the Ghana Health Service. Well, when we came here, we've not been allowed access to the campus itself. The security personnel here will not allow us to get access. Will not allow us access to the school campus itself. Some parents also who have been here have not been allowed access to the campus. Some of them have actually parked outside here, waiting to be given the opportunity to enter the campus and then, speak to their children, speak to their wards and all of that. So I've counted about 10 parents. Some of them are here also to, see their wards. And the difficulty here is that the school authorities are not willing to speak to us. They are not willing to give us any information whatsoever, aside from the information that has been put out there. In fact, the security man here, before you try getting access to the campus, he would have to interrogate you, know exactly what you're coming to do here before he would allow you access. But if you get closer to the gate itself, somewhere around this place, there's two parents who are seated there as it stands right now, waiting to meet the school authorities, waiting to interact with the school authorities. I don't know if you can hear in the background, the security man is actually telling us that we cannot get closer. Well, that is the situation here, Roland. The information we're picking up also is that for some of the students who have tested positive for the virus, they have been transferred to isolation and treatment centers. We are told also that they've implemented some measures here in this school to contain the situation. We are told that the number of students who usually go for dining has reduced considerably. They've reduced that so they can ensure proper social distancing and adhere to the COVID-19 health protocol. We are also told that counselors and psychologists are on standby to sort of help some of the students who may be experiencing some kind of trauma as a result of their colleagues testing, positive for the virus. Now, in that statement released by the Ghana Education Service and the Ghana Health Service, we are made aware that it's not just Accra Girls Senior High School that we have students testing positive for the virus. We are told that some senior high schools in the country have recorded cases, but the Accra Girls Senior High School has recorded most of the cases. And indeed, we are learning today that out of the a little over 300 students who were tested, 55 of them, 55 students, including teachers here, have tested positive.
Medical doctor has revealed he may have infected many of his patients with COVID-19 after treating one who eventually died from the virus. Now, the doctor took a COVID-19 test after the patient had died, but his results came after 15 days, during which time he had been attending to other patients. Health editor Fred Smith, who is a COVID-19 survivor himself, spoke to the doctor, who blames the situation on the lack of PPEs and the delay in testing.
Oh, I think if you go to any of our hospitals, the private clinics, the teaching hospitals, the teacher hospitals, I think if you do mass testing of the health workers, I think you'll be surprised to find over, I would put it 70 to 80% of us would test positive. And fortunately, we are not ill, we are asymptomatic. But the positivity rate I'll put in that region, because it is just about any ward you go to in my hospital has had a COVID patient mistakenly admitted there, and people will be there 2-3 days, then we realize that, oh, this is COVID. Or some people would test, some of them will suspect they test negative, and then with the last one done when they are dead, will come back positive. So I think the health workers are under assault. You know, we are no more just front line. We are front, center, and whatever you would say. You know, and for me, it's more of our families that scare me. We take these things home to our families. Yes, we may be asymptomatic, but you give it to a family member who will not be lucky and can become critically ill. Because this COVID virus deals with everybody differently. So the testing, healthcare workers, we should be routinely tested weekly. You know, we should routinely test. I mean, if people are workers at other places are being routinely tested, you know, people around, you know, the high people, the important people are tested. Their drivers, their security men are tested frequently. You know, healthcare. In my case, because I was asymptomatic, and the results took. You know, looking back, I should have. Just because my patient was positive, I should have self-isolated. But you remember, I didn't get this communication from any official channel that, oh, your patient test was positive, so we demand that you go for a week or two. I felt, well, so I continued to come to work. Guilty that if I didn't come to work, my colleagues would think I'm putting all the work on them. Some of the doctors involved in the care, as far as I know, didn't go to test. I volunteered and went and tested, only to find out 3 weeks later that I was positive.
So during that 15-day period, what were you doing? Were you going to work?
I came to work. I came to work regularly. You know, I did consultation.
You actually treated patients?
Sorry?
Did you treat patients?
Yeah, I touched patients. I treated patients because I sanitized, but I talked to patients. I examined patients. I did ward rounds, and only God knows if and how many patients I might have infected, unknowingly infected. That's the tragedy of the whole situation.
This is scary. What advice would you give in trying to improve management of COVID, especially in our health facilities?
The solution to the problem is obvious. First of all, the turnaround for the test should be to come within hours, at most a day or two of testing somebody. The results, we should have the results. As it is, turnaround time is going as long as 3 weeks or more. In fact, after my test was communicated to me, I voluntarily now stayed out. I took my whole family in to be tested. As I speak to you, it's been 10 days, going on 10 days, and the results is still not in. So, one, testing results the turnaround should be realistic, should come in time. And two, healthcare frontline workers should be mass tested, at least weekly. At least weekly, they should ever required to test. As it is today, when I met the group and I asked how many people here who have not gone to test since they started, at least 3 people raised their hands.
Now, currently, over 700 health workers are known to have been infected across the country. At least 2 have died. It's the reason a multimedia group launches the hashtag SAVETHEHEALTHWORKER campaign today. Shortly, we'll be joined by Winston Amwa, who's leading this campaign. But just last week, the Ghana Registered Nurses and Midwives Association voiced concerns about the pressure faced by its members at health facilities in the country. We will listen very shortly, but let's now speak to Winston. Winston, what are we seeking to achieve with this campaign?
Well, Daniel, what we seek to achieve is the fact that you had the medical doctor make the point that he tested, and after 15 days, it came out that he was positive. So he's actually not sure whether he's infected some people or not. And you've also talked about how 770 health workers have contracted COVID-19 and 2 of them died. Now, defeating COVID-19 is like going to a war, and the troops you have are the health officials or your frontline workers. So your frontline workers should be safe. Your frontline workers should be strong in order to help you defeat, COVID-19. So if they are challenged, if they are not strong, then what it means is that you're on the verge of losing.
Right. Winston Amwa there with our, who is leading the hashtag Save the Health Worker campaign, joining us to tell us how important it is for us to support the health workers now. Like I said earlier, some 700 health workers are known to have been infected across the country. At least 2 have died. It's the reason we are launching the hashtag Save the Health Worker campaign today. Of course, Winston will be joining us very shortly. But like I said, the Ghana Registered Nurses and Midwives Association have voiced concerns about the pressure faced by their members. Right. That's a story that we'll bring you in later bulletins. But now, in a related development, nursing mothers in the Afram Plains districts can smile, knowing that vaccines which will preserve the lives of their newborn babies can now be stored in an appropriate environment. Now, vaccines need to be stored in a cool place, so health workers on occasion keep them in refrigerators. Joy News story by Justice Bedu revealed Moses Gape, a nurse in the area, uses an ice chest to store these vaccines, which could be dangerous. Moses made a heartfelt appeal to the public for a refrigerator.
Moses Ganke is one of the country's frontline health workers, going at it alone in one of the places where many of his mates would rarely go.
Talking about the challenges, in fact, if I want to start, I can say I may not even finish.
This is the island community of Haji. It has no electricity, no potable water, and no mobile telephony network. The only clinic here was built by the villagers themselves. Moses recalls how the lack of refrigerator for medicines affects the work that he does.
Just last month, I did 5 deliveries. During delivery, you have some emergencies or complications, and those drugs that you can use to ameliorate those situations are supposed to also to be kept under cold chain or in the refrigerator as well. But where is the fridge? The deliveries, you have to do it because you don't have enemies. By the time you say you are referring them, they might either deliver on the bank or on the lake.
He has to travel on the sometimes turbulent Afram River using a boat, a journey that sometimes could take up to 2 hours to the nearest community that has electricity every day to store medicines like vaccines.
The facility we are not having engine boats, so I have to rely on people who are having. They don't even have commercial boats that apply to where I store the vaccines. So I have to be begging them, making arrangements. So by the time they are done, it's almost getting to see something. I am appealing to the authorities, the government, Ministry of Health, Ghana Health Service, and benevolent individual or Ghanaians. This one I'm not just appealing, I'm begging. In fact, I don't know if I should be on my knee, but maybe it will disturb your recordings. Otherwise, I will be on my knee. For them to come to our aid, to save these innocent children.
Moses' story is like that of many health workers in remote communities across the country. He is hoping that something changes about that soon. Justice Bedu, Joy News, Haji in the Afram Plains.
Hi everyone, welcome to Business. My name is Daryl Kwao. Domestic flights were today halted for about 3 hours as workers of the Ghana Civil Aviation Authority held a protest against encroachment of the airlines. The workers only agreed to return to work if government promised to intervene. Here's spokesperson for the workers, William Amwako.
Lands. Civil Aviation Authority, Ghana Civil Aviation Authority has 2 parcels of land. One at Lankwantanai, that's a Sarbuchi area, and one at Latias. This land is being encroached by people that we don't even know. There's one particular man, Clement Jato, who has taken charge of this place, and he goes about even threatening our staff, getting access to even our facilities to repair the vital equipment that we use here. At times it's even a challenge. And in certain cases, they have gone to the extent of even cutting some of these cables. So at times it affects our operations, and that's why we are embarking on this action. But of course, the Minister of Aviation and his deputy have been here. The Minister for National Security has been here, and they have given us the assurance that they are going to handle it. So we are standing down for now, and we'll monitor the promises that they have given, and if everything goes on well, then we solve the problem. We're actually fighting for the nation, not for ourselves. Yeah.
We had the Security Minister giving you up to Monday for some roundtable discussion. Are we going to wait till that Monday, and what are you going on board with that roundtable meeting?
Yeah, we have all our, plans. So what we expect that at that roundtable, all the people associated with the land will come on board, and we should be able to reach an agreement. So that is what we expect.
But your action is also impacting on domestic flights moving out of Accra and in of Accra. Are you going to resume, by this assurance from the minister, are you going to resume operation as soon as possible or with immediately?
Yes, we are resuming operation. We are giving him all the due respect, the promise that he has given. So we are resuming immediately all the suspended flights.
Well, so like you heard in that interview, the Minister for National Security, Albert Kandapa, has invited the workers to a meeting to find an amicable solution to the matter. He also assured of deploying some security personnel to the site until the matter is resolved. Darlington Akogo was one of the passengers affected by the grounding of flights as the workers of the Ghana Civil Aviation Authority protested. He shares his experience with Joy Business.
It's been strange. We were asked to come down from the plane because it was aborted due to an unforeseen strike apparently. So we came down and we waited for maybe about 30 minutes. Not much information was given to us, and then we were later informed that we can now board again. So we tried boarding again, but then once we were on the bus about to leave, we were informed that so it has been aborted again, so we had to come down. We waited for a few minutes, then we were told that it's okay, we have the clearance to go again. So now we are headed to the plane. It's been a weird, it's been a very weird experience of back and forth. Not so much transparency, but it seems that at least they are trying to resolve the issue. So it seems that the air traffic control personnel went on strike, I think, against the privatization of the airport. So that is what this is about, and I think that the airline staff are trying to resolve things with them. So at least for now, we are headed to the plane. Hopefully this time we get to take off and then without any issues again. So yeah, it's been a strange experience because most of us have plans that require us to be in Tamale at a certain time. So we are on the Africa World Airlines headed to Tamale. For me personally, I'm the founder of Carago AI, where we provide artificial intelligence and drone services to agro farmers, as well as plant breeders and agricultural scientists. So yeah, I was supposed to get them and map a whole field so that we help them detect diseases and work towards ensuring food security in Ghana and Africa. But then the more we delay here, the more it affects if we can actually do the map.
And that is the latest there. We have more coming up at the top of the hour on the marketplace. Up next, sports.
Time for showbiz. Becky is here, and may I say, you look lovely in black.
Oh, thank you so much, Daniel.
Yeah.
Thank you. I really appreciate it.
Yeah,
But TikTok is talking. Oh, no, it's Tick, actually.
Tick.
Tick.
So Tick is
says
talking.
that he doesn't...
TikToks.
Tick is talking.
TikTok.
Stop confusing me.
TikTok, I like that.
He says that he doesn't endorse disrespect in the music industry, and it's something that the young ones shouldn't do at all.
Let's hear.
When I hear somebody disrespecting me, I look at the person and their attributes, and I try to check their background, and then I conceive the type of person that he or she is. That makes me okay. So disrespect and new musicians and already made musicians, for me, it's something that shouldn't have been the topic of the day at all. But hey, we are being confronted with it, so we have to talk about it. And it's something I condemn, because I believe that it is not good upbringing. It doesn't show good morals, and so one should, weigh, the possibilities and know where they find themselves and how to talk whenever they want to say something or send something across. Because what you do today will teach the next person coming, and the next person may not be able to do it your way. The next person may even be beating when they want to talk.
Exactly.
They'll be beating people. So you don't want that. You don't want people to be beaten up here and there. So, I mean, we should all exercise respect for all.